Do you sometimes notice some sore in the corners of your mouth? This is a common condition that can be found in adults or in children, and there is no sex predilection. That means it can affect both male and females. What is this called? The cracks, the sore, the pain, the redness, sometimes found in the corners of the mouth, is called angular cheilitis. Angular cheilitis. So the cracks, the soreness, the redness are just symptoms, signs of inflammation. So it's usually an inflammatory reaction, but may become infected. Watch this video to get the causes and then the treatment of angular cheilitis. Generally, that soreness that's sometimes found in the corners of the mouth, usually caused by collection of saliva in the corners of the mouth, especially for people who drew saliva, have increased collection of saliva, people who do lip licking, sometimes people who actually suck, especially children who suck their thumbs or fingers, and then in adults who use dentures, or even young children that use artificial teeth. These are different causes of angular cheilitis. In older adults, in the elderly, there's something called recession of the bones, lower jaw bone, and then this changes the anatomy of the mouth such that the adults now may begin to draw more saliva and they are not able to swallow easily the saliva that is being collected in their mouth. Generally, for adults, anything that causes draining of saliva, including some medical conditions, in fact, even in women, use of lipsticks, use of some other chemicals, some other materials that the body may not even be able to tolerate. So there may be some form of allergic reaction also causing this soreness in the angles of the mouth. So in adults, whatever it is that causes draining of saliva, then lip smacking, lip licking, thumb or finger sucking, and then there are some medical conditions that may cause an adult, especially the older ones, to have drooling of saliva, and this may lead to the inflammation that occurs in the corners of the mouth. This may be infected, as I mentioned earlier, and then may require treatment. I'll be talking about the treatment towards the end of this video. In children, whatever it is that causes draining of saliva, that allows the saliva to collect in the corners of the mouth, normally there should be generation or secretion of saliva that should be swallowed. A certain volume should be in the mouth to help in keeping the integrity of that area. However, in some children with some medical conditions, there may be excessive collection of this saliva that can be collected in the corners of the mouth and lead to the cracks that occur in the corners of the mouth. Children who suck their thumbs, children who suck any fingers, children who do lip smacking, lip licking can also have angular cheilitis. Also, deficiencies of some vitamins can lead to angular cheilitis. Mostly the vitamin B complex, B1, B2, B3, B6, B7, B12. Deficiency of vitamin C, also low immunity, can lead to this condition. Let's talk about the treatment of angular cheilitis. Importantly, it is worthy to note that there should be no cause for alarm when this occurs. The first thing is to identify the cause. As I've mentioned in this video, there are different causes, so removing the cause will help to resolve the problem. First of all, that is, if you do lip smacking, you lip licking, you lick your lips, or you have a medical condition also that you are not doing a good follow-up for on treatment, then we may need to consider that in dealing with this problem. It could actually be very embarrassing. The face is the first place that most people see when they come across us. When we meet people, the first area they look at is our face, including the mouth, So the corners of the mouth are usually obvious. So if there's any sore, it could really be, apart from the pain that individual gets, the soreness, and then the embarrassment from the way the corners of the mouth appear. So it is important to stop what has been identified to be the cause. In children, you need to help the children to understand and to help them to stop lip smacking, to stop lip licking, and then thumb or finger sucking, which are not helpful for this condition. So we remove those factors. And then for children that may have some medical conditions that require specific treatment, then it's important to take them for proper treatment so that the drooling can be dealt with, considering the underlying condition also, which should be properly managed. What about deficiency of vitamins? You may need to see your doctor to get prescriptions for vitamins so that you can have the necessary deficiency taken care of. And then you can get some vitamins, some of these vitamins from food sources. Then, importantly, we should note that where there is infection, as part of the treatment, we may need to consider giving antibiotics. Your doctor may want to give you antibiotics, especially if these sores have been identified to be secondarily infected. An infection may be why some people actually have fever in the course of having this angular cheilitis. People may have fever as a feature, maybe loss of appetite, may also be other sores in the mouth, there may be skin rashes. There may also be some other symptoms and signs that may help to determine if a patient will benefit from additional treatment apart from removing the factors. Importantly, the doctor may want to take a blood sample to check if there is any ongoing infection, and then that will determine whether you need antibacterial, that's giving you antibiotics for treating any identified bacterial infection. And then some people actually may have a fungal infection because we can't see the microbes. It could be viral, it could be caused by a virus, it could be caused by bacteria, and it could also be caused by a fungus. So fungal infection, of course, sometimes the appearance, and then part of the test that may be done is to collect some bits from corners of the mouth. Then some chemicals are added and viewed under the microscope to check for a fungal infection. And so if the test confirms that there's a fungal infection, you will benefit from taking antifungal. Additional treatment will include to take care of your dentures. If you use dentures, artificial teeth, then you need to ensure that you clean them very well regularly so that they don't collect microbes for possibility of causing infection. And then some people may actually need to change their denture. For people who use other chemicals like lipsticks on their lips, then they may need to check whether you are reacting to such and then get them changed or stopped completely. Other important aspects will include good oral hygiene. So regular brushing of the mouth, of the teeth, morning and night are very important. Then some other oral medications can be used. So in this video, I have talked about angular cheilitis, the different causes of that soreness, the pain, the redness, and the cracks that you feel in your mouth, especially actually the angles of your mouth. I've talked about the causes in adults, the causes in children, and how to treat this condition. For further information and treatment, you need to see your doctor appropriately for evaluation and proper management.